My name is David Ceballos. I'm from American University Caribbean, graduated in 2012.
Okay, so what is your overall feeling about med clerkships?
Well, for my overall feeling med clerkships, as you know, I was just trying to research some different type of programs. I went through looking through ACA as well as American clerkships, as well as IMG prep, but it's iMatch. And I was trying to find the best deal possible. I noticed that some of those companies will actually promise you something, but then you end up going into clinics instead of going to university-based hospitals.
Right.
So I was a bit skeptical at first, and as you know, when I was talking to you over the phone, I wanted to make sure that everything was actually correct, that it was actually in a ACGME accredited hospital, in which after you give me the list, I was able to verify that those hospitals are there. And during my experience here, I've been able to go to ACGME hospitals every day.
How many hospitals?
2 at the moment.
And how often are you in the hospitals?
3 of them actually.
But how often?
How often?
Yeah.
I'm in the hospitals 6 days, Monday through Friday, and then the other one on Sunday.
So if you don't mind, describe your day to day, like a normal, just like your hours and what you would go through on a day-to-day basis.
Okay. So during my first week, I started out going to during 8 o'clock in the morning, which we went by, and from there he would actually bring us to the inpatient ward, in which we would be assigned patients depending on our level of experience and how long we've been there in the program. So usually people who have been there longer, he would actually provide them the opportunity to actually teach us on how to go around the hospital, use the system, and see the patients. And then from there, as we gain more experience, we will actually be able to see the patients on our own, which I had the opportunity, in which I saw one patient on my own during my time in SUNY for that first week. And from there, after I'm done seeing the patient, I would actually write up the notes. I would give him a presentation. He would actually critique me and tell me, okay, is this good, or no, you need to improve on this part. And then from there, I'm done for the day, in which he says, go to the clinic here where I'm currently at, and I'm with Dr. Ann, in which I'm here from 11 to the last patient, which could vary from as early as 4 to as late as 7. And over here in the experience at this hospital, my first 2 days before was first come, first serve, in which patient folders were put it on the new patient list, and we had some problems in which some people will actually get a lot of patients and others would not actually see patients. And during my first 2 days, I did not see any patients. I didn't really know the system at the time. So we spoke with Dr. Ann about it, and he actually corrected it, in which they said that all the notes will go to him, and he will actually delegate patients to the students.
So there's now a more streamlined process for everyone seeing patients. Okay.
Yes, so now it's actually much more even. And that's when we actually had about 8 students. Now we're about 12 students, and during this week, there's also some other students that are coming by about 4 in the morning, 4 in the afternoon, which make about 20
So they're just cycling in and out?
Cycling in and out. So pretty much they changed the system just a little bit, in which they put in a sign-in sheet of whoever comes there first. And we go in groups of 3 so that everyone will have the opportunity to actually see the patient. And right there, it just depends on the dynamic. Some people would actually be team leader for one patient, and the next patient they see, the other one become team leader, or they'll divide up the group in which one does the presentation, the other one does the physical exam, the other one writes the notes, and then from there they decide who actually presents to Dr. Ann.
Okay. Now, how do you think the level of preceptor interaction is? Are the doctors readily available to teach? Do you feel like they're open and honest with you? You get a lot of time with them?
Yeah, I mean, I feel that they're pretty open. I know it's pretty busy at times. I know I believe it's just the first 2 days, in which there was a time which I could not present to him, to the patient, and I asked him can we discuss this patient, and he said, yeah, we could do it in the morning next day. So he's actually pretty open to actually
Give you one-on-one time with him? Okay.
Yes. So I mean, eventually I got up to speed, and I was able to see my patient first. I was always the first one to see my patient, and then I was to present to him. Other people who actually are dropped off later during the rounds, they may not have the opportunity, but he has shown to me, at least to me, that he's actually open to discuss the patient later that day or the following day when he has the time.
Awesome, awesome.
So
Now, would you say you'd recommend like this preceptor and the rotation?
yes, I would definitely recommend Dr. An outpatient clinic. He is very open, and he likes to teach you to make sure that you understand the medicine and as well as patient care.
Awesome, awesome.